Polycystic ovary syndrome (PCOS) is a common hormonal condition that affects women of reproductive age. It usually starts during adolescence, but symptoms may fluctuate over time. PCOS can cause hormonal imbalances, irregular periods, excess androgen levels, and cysts in the ovaries. Irregular periods, usually with a lack of ovulation, can make it difficult to become pregnant. This may also have too much of hormone called androgen in the body. With PCOS, many small sacs of fluid develop along the outer edge of the ovary. These are called cysts. The small fluid filled with cysts contain immature eggs. These are called follicles. The follicles fail to regularly release eggs.
My name is Felicia. I'm Vaithis. So, can you introduce yourself?
Hi, my name is Violet.
Okay. So, this is our friend who has been diagnosed with PCOS for the past 3 years.
And for information, PCOS is Polycystic Ovarian Syndrome.
And we will be asking about signs and symptoms she experienced and how did she manage it eventually. What you experienced before you were diagnosed?
Okay, at first it was the usual, either it's like prolonged menstrual cycle or very irregular. It's like 3 months once, so it was very irregular, and I had a lot of facial hairs, which is very abnormal. So I went and checked, and about 3 years ago, and I got diagnosed with it because they found a few cysts in my ovary bag.
Okay. So, any other symptoms?
Yeah, I did had a lot of weight gains, acne, hair thinnings, and more. But then that 3 years of span, I tried to manage it quite well.
Okay, so how are you really confirmed that you were diagnosed with PCOS?
Oh, I did an ultrasound in the clinic, and doctors diagnosed me.
I see.
Let us find out how to diagnose PCOS. The most widely accepted method is the Rotterdam criteria, which requires the presence of at least 2 of the following 3 features to confirm PCOS diagnosis. The Rotterdam criteria is the oligo or anovulation, second would be vaginal ultrasound, third would be high androgen levels. Oligo or anovulation. Oligovulation refers to the infrequent or irregular ovulation. Anovulation refers to the complete absence of ovulation. This condition will result in irregular menstrual cycle or even no periods at all. Vaginal ultrasound, a diagnostic imaging procedure that uses sound waves to create images of pelvic organs. Presence of 12 or more follicles measuring 2 to 9 mm in diameter in each ovary, or increased ovarian volume which is more than 10 cm cubic observed. Third would be high androgen levels, elevated level of male hormones, androgen, leading to symptoms like hirsutism, excessive hair growth on face and chin, acne, and scalp hair thinning or alopecia. Next would be histology and cytology findings. Figure 1 and 2 above shows the gross appearance of numerous cystic follicles in the ovary. These ovaries are enlarged and started with multiple cysts, each typically measuring 2 to 8 mm in diameter. These cysts are often thin-walled and filled with clear serous fluid. The external surface of the ovary is generally smooth. The ovarian cortex may appear thickened and fibrotic. Figure 3 above shows numerous cystic follicles in ovary under microscope. These multiple follicular cysts are enlarged, fluid-filled follicles located in the ovarian cortex. The cysts are typically lined by flattened granulosa cells, indicating degeneration. The thicker internal layer is hyperplastic and may appear luteinized. This thicker layer can produce excess androgens. And figure 4 above shows cystic follicles stained in pink in H&E staining.
So, did they prescribe any medicine after that?
They did one. It's called Yasmin.
Okay.
Yeah.
The contraceptive pill?
Yep. And another one is an anti-diabetes.
Okay.
So do you have any side effects after taking the medication?
Yep, I do. I have bloating, feeling very nauseous, vomiting.
So, what happened after you start your treatment?
Oh, I somehow started to lose weight. I wasn't getting a lot or struggling to lose weight. I was like maintaining that, and then my skin cleared.
Okay, that's really nice. So, you're okay now?
Yeah, I feel way better.
Okay, so thank you for joining us today and cooperating with our interview.
Sure, for sure.
That's all from us. Thank you.
While PCOS itself cannot be prevented. So, the prevention is where we can manage in our healthy diet, regular exercise, stress management, and we can also consult a specialist. So, healthy diet just focus on the whole foods, fruits, and vegetables. Regular exercise at least for 30 minutes so that we can actually weight loss. And stress management is techniques like meditation and deep breathing. Consult a specialist is very important in to prevent polycystic ovary syndrome, where we have to regular checkups with a gynecologist so that we can prevent PCOS.